As he comes down the stairs, I can hear him laboring to breathe. And he comes over to me and he's like, "Hey, look at my leg." And he pulls up his pajama pant and his leg is swollen. So I said, "Oh my gosh, you have a blood clot. We need to go to the emergency room right now." They bring him in immediately and they sit him down and start taking his blood pressure, and he collapsed. And I thought he died. He was in the ICU for a couple days. He went into a regular room for about a day, and then he got to come home. It was a miracle. Of course, during this whole time, I am thinking in the back of my head, we don't have health insurance. What are we going to do? I did not get insurance until March 1st. My husband actually, during that same amount of time, had transitioned to a new job, and he was in a waiting period for his health insurance as well. So we took a gamble and we lost. It took us about a year and a half to pay off all of the peripheral bills. So they're coming in and it's a couple thousand here, a couple thousand there. Now we're paying St. Joe every month, $450 a month. I think that we probably have another 3.5 years that we'll be paying on that. I realize that we are very fortunate. We are more fortunate than a lot of families. For this, it would have probably meant bankruptcy. This is a problem with the system that we have set up as it is today. It's a system that allows a lot of people to fall through the cracks. If we were to have a system such as Medicaid for All, we can be sure that everyone is covered, every child is covered, no one has to worry about that gap in insurance. So I hear from so many families who say that one of the parents is working a job that no longer works for them. They don't like, they can't stay in this job because it's super inconvenient for their family, but they have to stay in this job because they need the health insurance. Our system was set up a long time ago. Society and our lives have just changed into something that looks a little bit different now, and it's time that our health insurance system changes right along with that. I should not have been standing in the emergency room with my husband that was about to die, completely surrounded by doctors and nurses, with a pastor with his hand on my shoulder, thinking in the back of my head, how on earth are we going to pay for this?